shown just how important high-quality, compassionate care for Pennsylvania seniors really is. The COVID-19 pandemic has demonstrated what it means to serve on the front lines and how important you are, not just to your residents, but to their families and your communities. We've seen your hard work, and at PHCA, we've been right there with you every step of the way to make sure that decision makers here in Harrisburg and Pennsylvanians across the state see it too. Throughout this incredibly challenging year, you have never stopped doing what you do best, keeping our most vulnerable residents safe. And despite all of the challenges, you have brought joy to your residents and spread hope throughout Pennsylvania. Welcome to Unconventional, the 2020 version of the PHCA Annual Convention and Trade Show. Good afternoon, everyone. First, allow me to settle the debate. Yes, those were my real dance moves. And yes, it took multiple takes to get them right. Ladies and gentlemen, I'm Zach Shamberg, and I am the president and CEO of the Pennsylvania Healthcare Association. And you are probably wondering about this Band-Aid on my forehead. Well, it wouldn't be 2020 if this weekend I hadn't had to get 5 stitches, 36 hours before this live address. But as we've said, the show must go on. So we are coming to you live from our state's capital, and I would like to officially welcome you to the PHCA Convention and Trade Show, or as we're calling it, Unconventional. So why unconventional? Well, because WrestleMania was already taken, but it's the perfect word to describe 2020 and really all that we've been through together. A little more on that later. But we are coming to you live for the next hour. And as a reminder, this is a totally virtual, totally online, totally internet dependent event. So anything can happen. Look, it already has. Anything is possible. And we're ready for the unexpected. I hope that you are too. So let me tell you what we have planned throughout the next 2 weeks. First, we wanted to make sure that Unconventional could be your go-to resource for CEUs. But we also knew that what you do every day wouldn't necessarily enable you to stick with us for 3 or 4 straight days of live sessions. So to accommodate your schedule, we made every learning opportunity on demand. Just think of us as the Comcast Xfinity of the long-term care world, but with better service. So whether it's 3 p.m. and you have a break in your day, or it's 3 a.m. and you just can't sleep, you'll be able to earn CEUs by accessing our on-demand sessions and watching them on your schedule. It's pretty convenient, huh? And the quality of this year's convention content is unlike anything that we've presented before. Of course, we have sessions geared toward our skilled nursing operators and our nurses. We've got sessions specifically for assisted living and for personal care, but we are especially proud to focus more than 15 of our sessions this year on COVID-19. And we're not just looking at operational issues either. In the coming days, we'll be uploading a very special Election 2020 overview from 3 of the brightest political minds in long-term care today. We've got a special session on diversity and focusing on promoting diversity in our facilities. And many sessions are focused squarely on leadership, how to find it, how to teach it, and how to create leaders in your organization. Now, if you still can't find something that you're interested in, let us know. Because the beauty of a virtual convention, besides having the ability to earn your CEUs in your pajamas, is that you may see new sessions popping up on the schedule throughout the next few weeks, just based on brand new issues that are occurring in Pennsylvania. Clearly, we can be flexible, we can adapt, and we can make this the best educational experience that you've ever had with PHCA. Now, those on-demand sessions, they're great. And starting at 3:30 this afternoon, they will be ready and waiting for you. But don't forget about our live sessions. You're obviously watching me now. And for the next 2 Tuesdays at noon, I will be here live to host some very important conversations. Later this hour, you're going to hear from Mark Parkinson, the president of ACA-NCAL in Washington, D.C. He's going to join us to talk about our sector, this pandemic, and what to expect moving forward from a national perspective. Because while we've done great work here in Pennsylvania, we need the support of ACA-NCAL nationally to truly be successful. So I'm very proud to welcome Mark, albeit virtually, to Pennsylvania. Next Tuesday at noon, it's our keynote speaker, our prime time event, and a first for the Pennsylvania Healthcare Association. The administrator of the Centers for Medicare and Medicaid Services, or CMS, Seema Verma, will be joining us for a very special one-on-one discussion and fireside chat. So we will need to find a fireplace. I'm learning, by the way, that it will be impossible to gauge your laughter in this kind of virtual format. So if I do make a joke and you think it's funny, please send me an email with the words "ha ha ha" in the subject line, just so that I know I'm on the right track. Thank you. We're very much looking forward to welcoming Administrator Verma to PHCA for that discussion. She's going to be providing a very interesting perspective on the COVID-19 pandemic and the support that CMS has offered us since early March. So we hope you'll join us next Tuesday at noon. And finally, on November 24th at noon, just before the Thanksgiving holiday, we'll wrap up Unconventional with a closing keynote from Ed Tyson. Now, Ed has gone on to do some amazing things in his career, and he's now a leadership speaker and an expert on energizing packed audiences. But years ago, long before I arrived, Ed actually got his start at PHCA. So a kid who worked his way up from a Harrisburg association to headlining events, what could be more unconventional than that? Now, don't think that we just stop there with education, because as anyone who has joined us for a convention can tell you, there's more to this event than just earning your CEUs. Starting tomorrow and occurring for the next 2 weeks, Wednesdays, Thursdays, and Fridays at 10 a.m. will be reserved for our PHCA regional roundtables. That's right, we're breaking up our attendee list into 6 geographical regions, and we'd love for you to join us for an hour, meet myself and the PHCA staff, and ask questions of us, and more importantly, one another. We want to know what's happening in your region, and more importantly, how can we help? We've also got designated office hours for some of our speakers, as an on-demand session doesn't truly allow you to ask questions or start up a conversation. These office hours will. So take a look at our website and check to see if your favorite speaker will have time available to talk. We'd love for you to join us for that too. We've also got our business partners and our virtual exhibit hall, where you can check out what our partners are offering and all the services they're providing. Every Tuesday from 1 to 3:30, including today, our exhibit hall will go live, and you'll be able to virtually visit a booth and set up a time to chat with an expert on how your facility, your community, or your company can improve. Because as always, what you're seeing today and what you will see for the next 2 weeks would not be possible without the support from our business partners. And finally, don't forget to download our Handbid app and take part in our silent auction. It is officially live right now. We've got gift cards, sports memorabilia, terrific prizes, and all proceeds go to benefit the PHCA PAC, our Political Action Committee. So that's our look ahead at the next few weeks. Additionally, the PHCA bylaws call for an annual meeting to be held each year at our convention. This year, there was no new business to bring before our membership, so unless someone wishes to raise an issue, we will conclude this year's annual meeting. Now, before we take a look back, I want to be very clear. Unconventional, for all that's happening and all that we're offering, is about you. It's about improving the climate in which you operate. It's about giving you the tools that you need to succeed. It's about teaching you something new, whether that's focused on the pandemic or other aspects of caring for your residents. PHCA is a member-driven organization. We exist to serve you, and our mission has never been more clear than it is today. I'm going to start by saying something that you probably haven't heard a lot. You certainly don't hear it during the press conferences from our state government. You don't hear it during your surveys or your RICB visits. You likely don't hear it on television or on the nightly news. But it needs to be said, and you deserve it. Thank you. Thank you for everything that you've done throughout these past 9 months. Thank you for sacrificing everything to protect our most vulnerable. Thank you for putting your safety second to someone else's. And thank you for sticking with long-term care, even as others have fled. Very early on, one of our PHCA board members, Quality Life Services, Steve Tack, compared the workers in long-term care to the firefighters and the first responders on September 11th. And while the circumstances are certainly different, I think that comparison rings true. You truly are the men and women running into the burning building as others have run out. You are heroes. You are our healthcare heroes. Every one of you has lived up to that special designation. And representing you and what you do every day has been the honor of a lifetime for me and for the members of our PHCA team. I have been proud to lead this association throughout the last 9 months. I have been proud to work with the members of our PHCA board, our board's executive committee, our ALPC board, our various committees, all of whom help steer the direction of our organization. I also feel very privileged to lead a team of hardworking and committed staff that know they work for you, our members. And I will be forever grateful to have spent the last 2 years alongside an incredible leader, a brilliant tactician, and one of the great board chairs this association has ever known, Sean Buckman. I want to personally thank Sean for his dedication to his role as our PHCA board chair and as our fearless leader. He has helped mold this association into what it always could have and should have been, a force to be reckoned with in Harrisburg and across the state. Sean's time as our board chairman will come to an end next month, and he'll be followed by Karen McCormick, the owner of Wilmac Corp., and a fantastic leader herself. But for now, today, Sean, this message is for you. I know I speak on behalf of every one of our members and our staff when I say thank you for the enduring impression that you've left on long-term care in Pennsylvania. It has been an honor to serve alongside you. Now, obviously, I wanted to say thank you to each of you in person. But this, like most things in 2020, have had to take on a decidedly different approach. A little more than 9 months ago, I was getting ready for Kalahari in Northeast PA for a brand new, one-of-a-kind convention venue, a convention venue with a water slide, 2 water slides actually, and game rooms and laser tag and incredible accommodations. And I was excited, and I know that you were too. But a little more than 9 months ago, I was also getting ready for something else. My wife, Vanessa, and I had announced that we were having a baby girl, and she was due in January 2020. So I was looking forward to that water slide, but I was a bit more excited about this, and I hope that you understand. Sure enough, on January 25th, on a cold, snowy day here in Harrisburg, my wife woke me up, kicked me out of bed, literally, and told me that it was time. And only 25 minutes after I was kicked out of bed and dragged into our family car, our daughter, Vivian Rose, was born. And as we were leaving the hospital, 3 days after we welcomed Vivian into the world, our nurses pulled me aside. It's flu season, they warned. You can't allow your daughter to get sick because the flu is what you need to be worried about right now. Talk about famous last words. Because just 30 days later, the world was turned upside down by a novel virus called COVID-19. Life as we knew it would be changed forever. And I remember, as I'm sure you do, the uneasiness of that time. Those initial days in late February and early March, as we watched this virus literally make its way across the earth and then across the United States, leaving panic and hostility and uncertainty in its path. And it was an early Saturday morning in March with Vivian laying by my side that I watched national news cameras descend on the Life Care Center in Washington State. You remember the story. The first confirmed cases of COVID-19 in the United States occurred in that nursing home in Washington State. Residents were contracting the virus and dying. Staff were getting sick and being forced to vacate their duties. Ancillary providers were dropping off supplies at the edge of the property and speeding away. Seeing those images and hearing those stories gave us a sobering indication as to what was coming. And the realization hit us. This could happen here in Pennsylvania, and we would need to be ready. It was clear even then, the seniors in our nursing homes, our personal care homes, and our assisted living communities were by far the most vulnerable to COVID-19. It was clear even then that residents or staff who had contracted the virus could be totally asymptomatic. It was clear that the virus was highly contagious and could spread quickly, especially in a contained area. And finally, it's worth noting, the Life Care Center was a 5-star facility. Even the best preparation was not going to be able to contain this virus. So the first thing that we did in the days that followed was talk to our counterparts in Washington State. And we asked them, what do we need to be ready here in Pennsylvania? We received 3 very simple solutions. Procure PPE, or personal protective equipment, find more staffing, and when it becomes available, get testing for residents and staff. At least those solutions seemed simple at the time. Because for the last 9 months, we have fought with every ounce of our collective effort for those 3 essential resources for you, your staff members, and your residents. But it didn't stop there. We fought for funding and a real, true investment in long-term care, and not just Medicaid for nursing homes either. We fought for liability protections because trying to beat COVID-19, as well as a greedy trial attorney from out of state at the same time, is almost impossible. We fought for collaboration, for a seat at the table, because hospitals are not the focal point anymore, nor should they be. We fought against an administration and any elected official who does not put you first in their relief effort, or who refuses to acknowledge that you are the men and women on the front lines. Ultimately, throughout these last 9 months, we fought for you. And I have never been more proud than I am today to stand before you as the leader of the strongest association in Harrisburg. And I didn't say strongest long-term care association. I said the strongest association in Harrisburg. Because when we speak on your behalf, and when you speak, people listen. So how did that happen? Think back to prior convention speeches just like this. For years, we've told you we're working on it. We've said influence doesn't come easy. It's going to happen soon. We've insisted we'll be a force to be reckoned with. We're just not quite there yet. So how did things change so quickly? Because of you. Because of the work that you're doing every single day, and because of the team that we have assembled here in Harrisburg. A theme has emerged from the last 9 months of the COVID-19 pandemic. And if you're like me, and if you're looking for a silver lining to come out of all this, I've got one for you. This virus and this pandemic has given long-term care a voice, a bullhorn, a reason to shout from the rooftops and plead for support from our elected officials in Harrisburg and in Washington, D.C. For the first time, maybe ever, you have the microphone. And very early on, starting in mid-March, we realized that this was our one shot to make our voices heard. So that's exactly what we did. Under the direction of Shana Varner, our new Director of Communications, we did not turn down a single interview request in the past 9 months. The Philadelphia Inquirer, the Pittsburgh Tribune Review, NBC 10, KDKA, Erie News, even the daily local news in my hometown of Westchester, PA. If a student newspaper called, we'd get our talking points ready. We shared our message with anyone who would listen. In all, we participated in nearly 300 total interviews. That's more than the last 5 years combined for PHCA. But we didn't just wait for them to come to us, because we knew to get the support that we needed, we'd have to take control of the narrative surrounding this sector. And that's exactly what we did. We got aggressive, and we took on state government. Our From the Frontlines media series, plus our countless news conferences, have enabled us to share the stories that we believe need to be reported. Staffing, survey, testing, visitation, voting, even the RICP program. We led the charge and we shaped the story. We participated in live call-in shows, podcasts, and more. In the Capitol building, PHCA had a seat at more than 10 legislative hearings. Dr. Fauci only did 4. So whether it was the Aging Committee, the Health Committee, the Policy Committee, legislators wanted to hear from us on the challenges that you were facing. And when they didn't want to hold a hearing, we brought the fight to your legislators, both at the state and the federal level. For the first time in our history, we held 2 legislative briefing calls for every single member of the General Assembly, one in April and one in September. More than 200 members of the legislature joined each of those calls to hear what you had to say. In addition, we held town halls with our 2 U.S. senators, Pat Toomey and Bob Casey, and countless video conferences with members of our congressional delegation. And the pinnacle of our advocacy, it all culminated in 2 meetings earlier this year with CMS Administrator Seema Verma. One in person in Philadelphia and the other virtually with our Pittsburgh area membership. So a sitting administrator at the nation's most powerful regulatory agency meeting with a state association to hear about long-term care issues. It simply would not have happened in prior years, but it happened in Pennsylvania in 2020. We have amplified your message and your calls for support. We have pressured elected officials to act through the stories that they're watching on the news. or that they're reading about in Sunday's paper. For years, we fought to get our message heard. Today, we're just deciding which message they hear first. But it's not just about sharing a message. It's about getting results. And it's difficult to look back on 2020 without recognizing the wins that we've had, even in the face of COVID-19. First, our impassioned call for funding. Last year, I stood before you in Valley Forge, and I declared victory after we increased our MDOI from 8 to 16 million. And I don't want to diminish that achievement because it was important for our high Medicaid providers. But this year, we learned about the federal stimulus dollars that would come to every state across the country. The Families First Coronavirus Response Act, the CARES Act, federal dollars were coming to PA one way or another. And we, you, your staff, and your residents got first priority from our state legislature. And it was a team effort. It began with our testimony in hearings, pleading for support. It continued with your phone calls and your emails, asking legislators to give you the tools that would enable you to keep your residents safe. It brought out the best in our business partners. John Kennedy of Kennedy PC Law Offices, for instance, a longtime friend to our association and membership, spent hours every day lobbying legislators and the governor's office, and then checking in with me to share war stories and good news. This year, John showed me how important those partnerships are between our providers and those businesses who support our sector in everything that we do. It finally culminated in late May as a direct allocation from the Federal CARES Act, approved by the General Assembly and signed into law by the governor. $245 million for nursing homes, $50 million for assisted living and personal care in a first of its kind payment to our ALPC membership, 295 total. That is what happens when a unified voice rises above all else and it demands to be heard, when it refuses to be silenced. Now, you're going to hear from ACA-NCAL President Mark Parkinson shortly, and I can't talk about our advocacy wins without discussing what Mark and his team have done in DC as well. Because of their relationships on Capitol Hill and the bonds that they've formed, they have secured tens of billions for our industry throughout the past 9 months, and billions have come to providers in Pennsylvania. Additionally, our associations teamed up and we fought for regulatory wins, telemedicine waivers, the 3-day stay rule, and the advent of the temporary nurse aid role, a brilliant initiative that was thought up by PHCA that we fought to bring here in Pennsylvania. Now, I hope to tell you in the coming days that our legislation to make temporary nurse aides automatically eligible for the CNA registry will pass the House and will be signed into law by our governor. But we're not there yet, so stay tuned. Now, you are also asking us every day, nights, weekends, about the ever-changing guidance and the evolution of recommendations from CMS, the Department of Health, and the Department of Human Services. And that's why I'm proud to say that we have the best team in Harrisburg when it comes to getting you the answers that you need, even amid a pandemic. Gail Weidman, our Director of Policy and Regulatory Affairs, literally the best and sharpest mind in Pennsylvania when it comes to long-term care, regulatory, and Medicaid issues. Chris Fisher, our Director of Quality, a former administrator who analyzes every situation and acts as if he were back in his building on the front lines. Kevin Cizik, our new Director of Assisted Living and Personal Care. His time spent in ALPC has allowed him to take on a role both as an advisor and a recruiter. At the same time he's guiding our ALPC members, he's bringing in new members by the dozen. And Zane Barrick, our data analyst and guru, a former pollster and a political analyst, Zane's whiteboard and his calculations put Karl Rove to shame. Reimbursement issues, Medicaid payments, Zane has got it handled. And that team has answered hundreds, if not thousands, of questions throughout the last 9 months on regulations, on policies, on payments, anything you can think to ask, they'll get you the answer. And if you weren't reaching out to them personally, you were reading what has become a flagship tool for this association and really for this industry, the PHCA Daily Update. I've been told that providers in Pennsylvania read Our Update and McKnight's, or Our Update and Skilled Nursing News. It's a testament to our team here that every day, just around 5:30 p.m., that daily update hits your mailbox with the latest breaking information that you need to know. And here's what you need to know about me. Last year, as I stood before our membership in Valley Forge at the 2019 convention, I talked about my personal investment in PHCA and in our membership and in this sector. I told you why this role is personal for me. I told you about my grandfather, my pop. He's a resident of a personal care home in Southeast PA. He was in a nursing home for many months last year. And this year, he was confined to his room as the virus ravaged the residents and the staff around him. My grandfather has dementia. This has not been easy for him, or our family, or the staff that are caring for him. Earlier this year, we celebrated Pop's birthday over FaceTime on our phones. We checked in with him via Zoom meetings on our laptops. And when we learned that he had tested positive for COVID-19, we said goodbye to him over the phone on our cameras. And I wasn't able to be on that call. I missed it without ever seeing the invitation. But I was lucky because I didn't need to say goodbye. My grandfather fought this virus at 88 years old with dementia, and he won. He is still with us today, smiling during window visits and still somehow commenting on how bad the Philadelphia Eagles are. And a month ago, during a window visit, he met Vivian, his great-granddaughter, for the first time. And I couldn't be more thankful for the staff who fought for him so that all this could happen for our family. He is why I do what I do. And he's the reason why I'm a passionate advocate. Now, I think about what the next few months and the next few years will look like for him post-COVID and after all of this is over. What will the future hold for him? What will it hold for our members, for long-term care in Pennsylvania? What will change? In a word, everything. Everything is going to change. And it may be impossible to gauge what the future of long-term care looks like right now, but I know what the future of PHCA looks like. We will change. We will adapt. We will get stronger with you. We will be proactive, not just reactive, in creating policy. We will lead both statewide and nationally. We will be looked to for our ideas and our vision. Mark my words, this is not your grandfather's PHCA, even though you're taking care of mine. As you know, in years past, we would celebrate at each and every convention with our PHCA Hero Awards, a collection of honors bestowed upon our Administrator of the Year, our Executive Director of the Year, and others. But how could we possibly choose just 7 awardees this year? You are all heroes, and this video is dedicated to you.
Heroes can be defined in all sorts of ways, from the superheroes we see in movies and comic books, to our military or first responders, to a parent or grandparent we've looked up to all our lives, and ordinary people who rise above to do the extraordinary to better our society. But the COVID-19 pandemic has given rise to a new kind of hero, the long-term care hero. Long before the first case of COVID-19 was confirmed in Pennsylvania, you've always been there, providing compassionate care to thousands of seniors in Pennsylvania's long-term care communities. And since the early days of the COVID-19 crisis, long-term care workers across the Commonwealth have exemplified what it means to be extraordinary.
When COVID-19 first, really came to the United States, I think, similarly to other viruses like COVID-19, I think people falsely thought maybe we wouldn't be affected by COVID-19. So once they realized that it was rapidly spreading, I think fear really was instilled in a lot of people, especially in our industry, because we care for the most vulnerable population.
In the beginning, some staff were frightened. Other staff hung right in there with us. The nursing leadership team right away began education with all the staff on all shifts. The leadership team was here morning and night to make sure that staff understood and the communication was taken down to the staff level.
We sent out all the information to the family members. The staff just jumped right in. Nobody had a hesitation other than to say we need to protect the residents in the community. So everybody came together. We made sure that we spoke to all the residents and the family members, and really it was just about the safety of others.
Trying to make sure that we're up to date with the latest information and making sure that the residents are also understanding what we're trying to do to keep them safe, because the residents are also all watching the news, so they're seeing things, they're seeing numbers, they're seeing what's happening in other nursing homes, and trying to allay their fears and allay the fears of the families has been a pretty big challenge, but I definitely think that our team has pulled together beautifully and handled that very well.
Faced with caring for a population that has been hardest hit by the novel virus, you've doubled down on your commitment to caring for and protecting those in need. It hasn't been easy, but your relentless spirit never wavered. Your resilience and courage in the face of adversity has inspired all of us.
The fact that the residents couldn't have visitors like they had before, we noticed an increase in residents' depression, loneliness. So the staff really had to take over for the family members and be the one that was there with the resident and comforting them during those times.
My campus specifically was affected by a COVID-19 outbreak. That was something that I don't think that anybody could have ever expected, that it would be the way that it was. And our staff members sat alongside of many of our residents, who had COVID-19. And we didn't know at that time whether they were going to make it or not.
I mean, every day they come to work, they take away from their own family to come here, not, worrying about the chance that we're going to catch it and bring it home. We all have kids, and with everything changing, and it's been difficult, but they've all gone above and beyond.
Of course, activities has changed greatly, which put the activity staff in a vulnerable position with trying to find things to keep people's minds active and take some of the worry off and relieve some of the fact that they weren't able to see their relatives and things. So we were kind of filling in for the missing relatives that they weren't seeing.
I know that I tell people that I feel as if our residents are my adopted grandparents, and I love them and care for them in that way. And I know that all of my staff members who are in the building would tell you the exact same thing.
When we couldn't visit our loved ones, you cared for our parents, our grandparents, our friends, and our neighbors. You cared for them and protected them as if they were your own, putting their safety and their well-being above yours. Because of your hard work and sacrifice, thousands of Pennsylvania's long-term care residents are now beating the odds.
I would want the general public to know that healthcare obviously is a career choice, that many people choose to make, but what they never assume is that they're going to go through a pandemic.
The staff that's working in our building and buildings across the country are definitely dedicated employees. There is no way anyone would want to go through this without having that dedication, that care and concern for the residents that we serve.
We had staff working 12, 15-hour shifts, spending one-on-one time with our residents who had COVID.
The people who work here are heroes. We have the signs everywhere in all the yards of every community that you drive by, and it's 100% true. It's not something that you just say off the cuff, because they've really dedicated their lives to taking care of people in a situation that they've never dealt with before, and I know that they're scared, and they've been such warriors to go through it.
It really is truly remarkable to see, oh gosh, it really is truly remarkable to see the commitment of our staff, because everybody comes to work and everybody has a fear in the back of their head of the virus, and their grandparents at home or their mom who has cancer, and they still continue to commit and to show up and to care for our residents, and it's really just truly awesome to work alongside of these people. So, we're forever grateful to our team.
Your commitment and courage to our communities in the face of such danger will be admired for years to come. And I, for one, am so proud. Thank you.
I have never been prouder to be associated with this profession in my life, and I've been involved with this profession for over 40 years. Thanks to all of you for everything you do every day. Congratulations, and keep up the good work.
I am also humbled by the sacrifices that you have made and continue to make to protect and care for those who need us the most during this time.
I couldn't thank you enough. I couldn't be prouder to be part of this industry. And my heart goes out to you. Thank you for everything you've done and continue to do every day.
Just want to say how much respect, admiration, and appreciation I have for all our frontline heroes in all of our facilities throughout Pennsylvania. Thank you for everything you do.
I do believe, though, if there's one thing that we can point to that's been a very positive development throughout the past 7 or 8 months, it's the fact that the world outside of our sector has seen the true dedication that you bring to your work every day in helping to safeguard the lives of residents, patients, and staff.
But let me offer a sincere and heartfelt thank you for all that you've done and all that you continue to do.
I'm here today to give a big shout out to all of our frontline healthcare heroes with ProMedica Senior Care and all of those throughout Pennsylvania Healthcare Association. Thank you for what you do. God bless. Take care.
So I want you to know that I stand with you in this fight, and I'll keep fighting for your facilities, for your residents, and for your workers. Thank you, and God bless your work.
And thanks again for the opportunity to address you and for the essential work that you have done and continue to do for the residents of our Commonwealth. Thank you very much.
In these unprecedented and unconventional times, you are emblematic of what it means to be a hero. On behalf of the entire team at the Pennsylvania Healthcare Association, thank you for your dedication to providing the most compassionate care to our most vulnerable residents.
Again, to everyone watching today, thank you for your continued effort. Know that we have gone to battle with you, and we will continue to fight alongside you and for you every single day. We will fight for your residents. We will fight for your staff. We will fight for everything that you need to beat COVID-19. And next year, we will celebrate at Kalahari Resorts in person and marvel at all that we've accomplished together. And you'll see Vivian and I on the water slide. Thank you very much. Ladies and gentlemen, I'd like to now introduce Mark Parkinson, the President and CEO of the American Healthcare Association, which represents over 14,000 skilled nursing facilities and assisted living centers. A bit of background, Mark served as the 45th governor of the state of Kansas, and prior to that, he was the owner and operator of long-term care facilities in both Kansas and Missouri. Under Mark's leadership, AHCA focuses on delivering policy solutions to Capitol Hill and to CMS with a special emphasis on quality care. I am proud to tell you that AHCA is now the largest association in long-term care and is at record membership. So Mark, thank you for joining us and welcome virtually to Pennsylvania.
Well, Zach, thank you very much. And it is absolutely great to be here with everybody today. I got to tell you, Zach, that was a hell of a speech. You made us cry. You danced, told a joke. I've seen a lot of speeches, and that was awesome and inspiring. It's really great to be part of this virtual unconvention. And as great as it is, I hope this is the last ever Pennsylvania virtual unconvention, because it's obviously not great. But as Zach said, we're going to do what we can to make the absolute best of it. I really am glad that I have an opportunity to spend some time with you today. I want to start out the way that Zach did. I want to start out by saying thank you. And Evelyn, if we could go to the first slide, I want to thank you for your membership. As Zach indicated, we are at record membership right now. And the next slide, I think Evelyn is the one that shows that. We had been some concerned about what would happen in the pandemic. Would people leave? Would they leave the association? Would folks, fragment and become divided? And the opposite happened. Just as you and your staffs heroically ran towards your buildings, you ran towards us and you provided us support that we've never had before. And I think a good part of our success is because we've united. We can go up to the Hill, we can go to Harrisburg, and we can talk about the strength of our membership, and it makes a huge difference. I also want to thank you for what you've done in Pennsylvania. To get to the point that you have, where you're now the strongest association in the state, to get the kind of policy results that Zach talked about, very few states got anything for assisted living at all. And most states didn't get anything for nursing homes. And so for you to achieve what Zach outlined is remarkable. And I will tell you, it happened for two reasons. They both relate to leadership, but it happened for two reasons. First, you have a great association. And as you just heard, you have a fantastic leader in Zach. I was talking with Michael Wiley about this a few days ago. I hope you wouldn't mind me telling the story. And we were talking about Zach, and Zach said, Michael said, I can't believe I'm saying this, because, Zach's been in this job for a short period of time, but he is already one of the very best state execs in the country. And you look at the record and it proves it. So hats off to Zach and to the staff. But really more important than that, more important than me at AHCA, Zach at PHCA, are the members. We have been blessed to have folks that understand that it's not going to work if you just look out for your self-interest. It will only work if you look out for everybody and if you come together and if you are united. And so I completely agree with Zach's assessment of Sean. I have also enjoyed getting to know Karen over the years. I look forward to her leadership in the future. And last but certainly not least, Michael Wiley. I mean, one of your past chairs has been one of the past chairs of the National Association, where he made an enormous difference with his leadership and continues to make an enormous difference. So again, just thanks to the association and to all of the members. I'm going to cover 3 points very quickly that I think are quite important. First, I'm going to talk about how this thing happened. How did we end up with the disaster that we've had? Then I'm going to talk about what the DC response has been and what you might be able to expect in the upcoming months. And then finally, I'm going to talk about why I'm optimistic. why I think we're going to come out of this thing. So let's talk about how this happened. And the slide that Evelyn just put up on the total number of resident cases just shows the depth of this incredible crisis. We've now had over hundreds of thousands of COVID cases in our buildings. Between skilled nursing buildings and assisted living buildings, we're approaching almost 100,000 deaths. How did that occur? Well, I'm here to tell you what I know that you already know, but that we have to deeply understand and explain to our critics, and that is that this was not our fault. This occurred because COVID-19, unlike all of the other viruses that we have fought in the past, is spread by asymptomatic carriers. People who have absolutely no symptoms have been spreading it to our residents. Now, all of the prior viruses that we have fought have symptoms. And so all of our infection control protocols are based on symptoms. When an employee becomes sick or has a temperature or a cough, we send them home. When a resident has the same, we quarantine them. But that didn't work with COVID. Because what we have learned with COVID is that some people can have absolutely no symptoms at all and yet still spread it. Other people don't develop symptoms for 5 to 7 days and yet still spread it. And that is what happened to us in January, February, and March. People had this virus. We had no way of knowing that they had it, and it was spreading in our buildings. Perfect infection control back then would not have stopped COVID. Perfect infection control didn't require us to wear a mask every time that we transferred a resident, or every time that we fed them or hugged them. It just didn't require it. And I'll tell you very quickly the story of Typhoid Mary. Typhoid Mary, I'm sure you've heard that name, is a woman that lived in New York in the late 1800s. Unlike everyone else that contracted typhoid, she showed no symptoms. And yet, because she showed no symptoms, she continued to work. And unfortunately, she was spreading typhoid. That one person, Typhoid Mary, an asymptomatic typhoid, was responsible for so many typhoid cases that there was a pandemic in New York City just because of her. What we have had in this country isn't one Typhoid Mary. We have had tens of thousands of Typhoid Marys. This is not our fault. Now, Evelyn, I'm going to ask you to move forward through a few of the slides just to move this along. Let's move a little bit further, and I think 2 more slides after that. Can you advance beyond that? Okay, 1 more after that. Actually, it's the next slide after this next one. Okay, 1 more slide. This is a slide that really gets to the heart of who is responsible for this. And I know that's a very, very busy slide, but perhaps the association can send this around. There are independent analysts, researchers from the top universities in the world, Harvard, University of Chicago, Brown, and they looked at the incidence of COVID in buildings and what it was connected to. And what they found was that it wasn't connected to whether you were a 5-star building or a 1-star. No relationship. Wasn't connected to whether or not you had a history of infection control problems. No relationship. The only strong relationship is this. If you are in a community that has a bunch of COVID, you're going to get it in your buildings. If you're in a community that doesn't, you probably won't. So early on, when every building in New York City had COVID, it's not because they are all bad. It's because they were in a community that had a bunch of COVID. And when almost no buildings in my state of Kansas had COVID, it doesn't mean all the buildings are great. It's just that there was no COVID in the community. This is not our fault. It has to do with community spread and the fact that it is spread asymptomatically. Now, once we knew that, we would have had a fighting chance to beat it if we would have been given the equipment and testing that we needed, but we weren't. Bottom line, it's not our fault, and it's deeply important that we understand this, that our residents and families and staff understand this, and that the policymakers understand it, because once they get it, once the light bulb goes off, then they start becoming cooperative and help us with our ask. Second point I want to get to, and Evelyn, if we could go to the next slide, is what has the DC response been? Well, the DC response has been really good on the skilled nursing side, and we got some work to do on AL. So I won't go through each of these specifically, just in the interest of time. You're aware of them, but at a high level, I will tell you that once we were able to convince the DC crowd this wasn't our fault, and that if we weren't given the resources that we needed, more people were going to get sick and more people were going to die, we got a ton of help on the skilled nursing side. And a lot of this help is going to continue. For example, the 3-day stay waiver is tied to the public health emergency. We expect that they will continue to declare a public health emergency probably into the summer of 2021, and we will be able to keep that 3-day stay waiver. We've been able to achieve a clean payment rule with PDPM. It's not going to be changed. We've been able to get the sequester lifted, another 2%. That ends at the end of 2020, but we're hoping to get that extended. In short, we've received a lot of help, and we think we're going to be able to continue to get additional help into 2021. Our hope is to get you sufficient funding to make up for your lost revenue and your increased expenses until we can get to a vaccine and beyond the vaccine into fixing census. Next slide shows that unfortunately we have not had the same level of success with assisted living. And that's not because the policymakers here don't like assisted living. It's not because they don't think assisted living should be funded. It's because they really didn't understand assisted living. So when we went to the government and said, hey, we need help for AL, what they said was, look, we don't regulate AL, we don't pay AL. Let us focus on the Medicare providers like the skilled facilities first and then talk to us. And so that's what we did. And we came back to them after we got the initial payments for SNF, and they said, okay, we agree, we should pay. But even then it was hard because the government, since it doesn't regulate AL, since it doesn't pay AL, they didn't even have a list of who all the AL providers were. So we accumulated the list, we accumulated the taxpayer ID numbers, and we got some payments. And I think the good news is that now that we've gotten the payments for AL, we've made the breakthrough. I think that we can get more in the future. Okay, now let's talk about what's next and why I'm optimistic about where all of this is headed. And if we could go to the next slide, Evelyn, I just want to talk very briefly about 3 different things. First, testing is going to get better. Now, I know we had a horrible nightmare of testing problems in the spring. It got a little bit better in the summer. I think we reached a turning point when folks came up with the Abbott test that can be done quickly, inexpensively, with pretty good results. There's going to be more Abbott test-like products. And so as we continue to fight this, and I think we'll be fighting in our buildings over the next 4 or 5 months, our testing will get better. The second thing I want to talk about, and the thing that I'm most excited about, is the vaccine situation. As pathetic as the public health response has been, as bad as some of the policy decisions have been, the scientists have been impressive. The scientists have done great. And I've been optimistic about the vaccine development, and that has been confirmed yesterday when Pfizer announced over 90% success rate with the vaccine. And the really good news is that there are 3 other companies that are also in phase 3 clinical trials, and their vaccines are very similar to the Pfizer vaccine. I think it's highly likely that next week or the week after, Moderna will announce that their vaccine is effective. And then at the end of November, I think we can expect to hear AstraZeneca say the same thing. And at the end of December, I think we're going to hear the same thing from Johnson & Johnson. And what that will mean is that we will literally have tens of millions of vaccines before the end of the year. Now, we have not only been able to achieve our facilities as being a priority, we've been able to get a turnkey program. And so I know that all of you now have signed up for that program. It's extremely exciting. And I think there's a good probability that by late December, early January, our frontline healthcare workers and our residents will be getting vaccinated. And I suspect that we'll have complete vaccination of our staff and residents by the end of February. And that's going to be a really glorious time. It's going to be a time where we can actually tell the world, hey, the absolute safest place for an older person to be right now is in a long-term care facility. Because it's going to take months to vaccinate the general population. The complexities of the vaccine are immense. But I really feel like our facilities are going to be in pretty good shape once we get past the 1st of March. So what does that mean? Well, at that point, I think we can start to recover. The clinical nightmare will be over. The fear that our employees have had to have will be over. Our residents will be much safer. And I think once we get to that point, we'll be able to open up visitation, confidence will redevelop, the demographics that haven't changed will kick in. And I'm hopeful that census will start to recover because I know that we can't have a complete recovery until we have census. Now, finally, I know that liability is an enormous issue. We're fighting that hard. It's our top priority. The election results give us real hope that we're going to be able to get liability reform as well. So I'll close in the same way that Zach opened, which is just to tell you thanks. Thanks for your support of us and our efforts. But more important than that, thanks for what you do every single day. I mean, if there's anybody that could have watched that last video with those CNAs talking about the heroism of their staffs and their team members and not understand that it is an honor to work on your behalf, then they just don't have a pulse. So let me just say it again. On behalf of the 90 people at ACA-NCAL, it's an honor to work with you, and it's a pleasure to work with Zach and his team. And, you know, we're 2/3 of the way through this, and we're going to make it to the end. Thank you very much.
Thank you again, Mark, for joining us. I can't tell you how much it means to us as an association and to our membership that you took the time to join us today. I also want to thank all of our attendees for joining us live. So now our exhibit hall is live. We're open until 3:30, and then our on-demand content goes live. So thank you for joining us, and we will see you back here at 12 noon next Tuesday with CMS Administrator Seema Verma.